All right, we'll go ahead and get started as others start to join here. But welcome everybody to our educational presentation, Positive Behavior Strategies. My name is Jason. I'm the host for the evening in this brief talk. Today's presentation was developed specifically for parents, caregivers, and teachers to respond decisively to undesirable forms of communication from children. Maybe they're our own and maybe they're not. But that's what makes this presentation so special. Regardless of the relationship to the child, these delicate and gentle approaches will help you turn those challenges into a win-win. The presentation today is not intended to be all-encompassing. In fact, this is a very complex topic that has been magically refined and developed to form into what are contributing factors and a few strategies that can alter behaviors. We'd love if you contribute to the topic today. All you have to do is add your questions into the chat box as we go along. Positive behavior strategies is courtesy of Key Autism Services, a quality provider of ABA therapy services in-home and in-center, serving all children and adolescents birth to age 19. Which brings us to the brains of the operation today. That's our presenter, Brittany Degner. She is the Center Director for Key Autism Services Colorado. She has dedicated over a decade to serving individuals with special needs across clinical, home, and school community settings, and has been working within the pediatric behavioral health community as a master's level board certified behavior analyst since 2016. She developed today's presentation as a resource to help important stakeholders in young children's lives. I don't know about you, but I'm ready to hear what we've all came here for. With that, I give you Brittany Degner.
Hi guys, thank you all for joining us tonight and for Jason for that very nice warm welcome. I hope you guys, if you're local to Colorado, are staying warm out there tonight. But yes, as he mentioned, please feel free to use the chat functions throughout this talk. We will be answering most of the questions towards the end, mediated by Jason throughout. For tonight, just a general who are we? We'll talk about a little bit. What is autism? Some ABA basics. The main meat of the topic tonight will be functions of behavior and what best practice strategies we can use that are most typically found in ABA services that we provide. Keep in mind, this is a very broad topic, and tonight is just a brief snapshot of some of that to get a better understanding of where we're coming from in the field of ABA. As Jason mentioned as well, Key Autism Services is compiled of a team of master's level BCBAs that work directly with the families and supervise the direct service behavior technicians providing the one-to-one ABA therapy that can take place either in-home, in schools, or in the community settings. And I am located in our Centennial Center as the center director here. We do serve ages birth to 19 in our center and at home, comprised of doing functional assessments. We have several collaborative partnerships for other providers, and we highly involve parents and caregivers throughout our therapy process. As many of you probably already know or are familiar with, the diagnosis of autism, according to the DSM, has two main points. The first being social communication deficits, which could be deficits in communication, limited shared interests with peers their age, having a difficulty expressing their own emotions, understanding or expressing nonverbal communication, and having difficulty building or maintaining friendships and other relationships throughout their life. The second factor is comprised of restricted or repetitive behaviors, which can include inflexibility in schedule routines, having fixated interests or topics of conversation, stereotypies, which can include motor, visual, or oral, and sensory input needs, either hyper or hyposensitivity to sensory input. Additional criteria includes that these symptoms must be present in early development and that they cause clinically significant impairment, leading them to not being able to attend school in a general education classroom or participate in their community to their fullest. They also may or may not accompany intellectual, language, or other impairments alongside the diagnosis. Some basics about what we do on a day-to-day basis. So ABA stands for Applied Behavior Analysis, often shortened to ABA therapy, which is the science of behavior and how it is affected by the environment. The main goal is to, in a very simplified version, increase behaviors that are helpful and decrease behaviors that are harmful or affecting learning and participation in their day-to-day communities. We do increase language and communication skills, can assist in improving attention, play skills, social skills, memory, self-care, and academic related skills, with a main focus of decreasing interfering behaviors in today's topic. AB is not a one size fit all, and we're not just discrete trials. Our services are tailored to each individual to increase independence in their environment and not cure the symptoms of autism. Decreasing all behaviors that a parent, caregiver, teacher might see as problematic in certain environments isn't realistic. So understanding what is quote unquote okay or normal for a child that age to express is also important. And we really want to focus instead on behaviors that interfere with their ability to learn and hopefully minimize the support that they need to be successful. Throughout that process of determining behavior and modality for replacement is determining what the function of behavior is. The function is a common theme throughout our field where we can use that term to describe a likely reason why the behavior is occurring, known as the function of the behavior. We then use that to help us identify a replacement for that behavior with a more appropriate one. And lastly, develop a program to teach these essential skills, known as functional replacement or a functional repertoire. There's 4 main functions of behavior. They're not all standalone. They can also happen in combination. The first being to get attention from someone else, attention maintained behavior. Followed by tangible, trying to get access to an item or activity that might be mediated by someone else. Escape might be a common one that the teachers of the group or parents trying to get their kids to do chores come across, where a child is trying to escape or avoid something. And the last being automatic or sensory, where physically doing this activity feels good or relieves something that feels bad. So we got a bug bite and we scratch it to relieve that itch. There's several more than just 10, but these are the main best practices that you'll see throughout ABA therapy. And we're going to highlight a few of those in more detail today, but it includes things like modeling, incorporating social stories, the Premack principle, also known as Grandma's rule, discrete trial teaching or DTT, behavioral momentum, prompting and fading, reinforcement, naturalistic environmental teaching, or NET, using task analyses, or token-based systems. For modeling, most children learn to imitate when they're fairly young. So this is a way to be able to provide a visual model of what we're asking the child to do. It's allowing them to see what the expected behavior is, such as this caregiver assisting the young girl in washing her hands, or the two boys eating lettuce from their salad together. It also helps decrease the opportunities for incorrect interpretation of what the expectation is. The Premack principle, or grandma's law, is really a first then presentation of the task, where a person is more likely to perform a non-preferred task if it's followed by a preferred task, item, or activity. So first, eat your vegetables, and then you can have a cupcake. Or first, put on your shoes, and then we can go to the park. Or first, clean up your toys, and then we'll go watch a movie. Behavioral momentum is also known as high probability tasks, is when using a series of high probability or easy requests is used to increase correct responses with lower probability or harder requests for the child. So this is most often used when there is task refusal or attempted escape maintained behaviors. So think of when in this picture, these kids are all playing Simon Says. Every time the instructor says Simon Says, followed by an action, you're going to follow through with it. The trick of the game is to get you to do something even when Simon doesn't say. That is the example of using behavioral momentum. Prompting and fading. So these often go hand in hand. For the prompt hierarchy, you can see off on the right-hand side. From the top down is least to most. So you're starting with the least intrusive prompt to assist the learner in obtaining the correct response to increase their likelihood of contacting reinforcement for those responses in the future. This usually comes after the instruction is given, but before the child is respond. The visual prompt, which it says underneath could include positional, would just be having the correct response be slightly closer to the child. And it goes all the way down to full physical, where we're physically guiding the response, such as washing hands on a previous slide. Where most to least, we're prompting with the most intrusive one first. This is to help avoid errors and incorrect habits. And here's why that might be used. I don't need a raise of hands. I'll vouch for myself on this one. But who, not to name names, might have a terrible sense of direction? I am fully aware of this skill deficit in my repertoire, but if I'm driving somewhere and happen to get lost and take a few wrong turns, but still end up where I needed to go, I will likely take the same convoluted path next time. It's not because it's the shortest, but it's because it's the most familiar. Our students are the same way. We want them to learn the shortest path to do the correct response and not another incorrect chain of responses pasted in the middle. So in ABA, this can often be called errorless learning or errorless teaching, where we help the student get the correct response before an error occurs, and then use the fading portion of this slide to reduce the amount or the intensity of the prompt in subsequent trials or examples that the child gets practice in. Reinforcement is not only one of the most powerful strategies for teaching your child, it's also probably one of the most common. A reinforcer can be anything that your child enjoys in that moment, like praise, good job, hugs, preferred toys, even removal of a task is reinforcement. There's a little acronym underneath, which is EATS. It can be an edible, an activity, a tangible item, social engagement, or sensory needs. Reinforcers are known to increase the occurrence of behavior. So if a child has free access to items throughout the day or throughout their learning opportunity, this will likely reduce the impact of that item being a reinforcer. The example of too much of a good thing. I want to caution this that we don't want to accidentally reinforce these undesirable behaviors that we're talking about today. A common example is reprimanding or saying, don't do that if you have a child that seeks any sort of social interaction, whether it be positive or negative. And the easiest way to do that is to catch them being good. Naturalistic environment teaching, or NET, is kind of an umbrella term in our field where instruction occurs very naturally throughout the child's daily routines or within their natural environment. The adult is following the child's lead and the child's change of interest throughout the teaching time and creating teachable moments throughout play. It can be used at home, at school, in centers, in community settings. For example, this child and adult are playing with Legos, which let's just say is a favorite toy of his. A teaching goal for him might be that the child is able to identify colors. So the adult can easily introduce the idea of building Legos or stacking them together, adding a piece after each correct identification of the color of the block. Task analyses are another one that we'll highlight, where there's a written process of teaching that divides complicated activities into teachable sections, where one step has to come before the next, such as tying your shoes, folding laundry, or being able to independently brush your teeth. These are helpful because it keeps teaching steps very straightforward for different adults or support systems to be able to provide support when needed throughout the task. I know we only highlighted a few today, but these are some other proactive versus reactive strategies to behaviors. Proactive being setting realistic demands, knowing your child's strengths and weaknesses can really play into learning. Be prepared to follow through. If you ask them to do something and expect them to be able to complete it on their own, make sure that they complete that before moving on to another activity. Provide choices when possible in presenting a task. And don't be afraid to get your hands dirty and model the expected behaviors. You want to be able to prime children and students for what's to come. For example, keep in mind later tonight after school, we have swim lessons that we're going to go to. The Premack principle or Grandma's law, which is using first then statements before presenting the task. Behavioral momentum, just starting with easy things for them and building up to the harder task at the end. and using visual supports and prompts when needed. On the other hand, reactive strategies, we just want to caution to avoid power struggles, the back and forth or negotiating through a task. And instead, we can prompt on subsequent responses or expectations. Like tying shoes, there's often two shoes that have to be tied. Maybe help with one and see if they can do the other. And create motivation with novel items and activities. So this is where creativity comes into play. How can we make the same old toy seem new and exciting? Or how can we combine that toy with another toy and create interest somewhere else? Also, wait for them to be calm and ready to learn, and remove as many distractions from the environment as possible. That's all I had for us today. Any questions that came through the chat?
Thank you so much, Brittany. And yes, it looks like we did have a couple questions here that came through email. The first one is, thank you for providing positive behavior strategies. Can these be used in combination?
Yes, they absolutely can be, and I would say they should be in most contexts. It's not a one size fits all within these strategies as well. And using them in combination and switching them up through your teaching styles is a great option.
So thank you. And the other question here is, my child has a little more intensive behaviors. In what way do I get started?
Yeah, also a great question. I would start by getting in contact with someone who is comfortable in conducting a functional behavior assessment first, and use that as really your first point before modifying any other teaching strategies, either at school or at home.
That's wonderful. Well, that wraps up our presentation today. Thank you all for joining us today. We will be sending this out by email to everybody that joined, so that you'll get a chance to review this in the future. Thank you all for your time. Have a wonderful day, and thank you, Brittany.
Yeah, of course. Have a good night, guys.